Hello, welcome to MOT 115. Today we're going to be discussing transcultural communications with cultural competency and linguistic services. So, when we think of the term culturally and linguistic appropriate services, what we're really looking at also is cultural competency. So starting up at the top, number 12, or at 12 o'clock if you are so inclined, you have improved quality of care. And of course, as a healthcare professional, that is the ultimate goal in any of the potential areas in which we work, is we want them to feel better. Increased client satisfaction at 3 o'clock. That tells us that our clients are happy with the services that we're providing them. Then at 5 o'clock, decrease in errors. We all want that. Nobody likes to make mistakes, and especially in a healthcare environment. Increased patient compliance. When we discuss patient compliance, it's one of the toughest issues that we manage, because as the old saying is, you can lead a horse to water, but you can't make him drink. You can do everything in the world for your client, but it doesn't necessarily mean they'll do it. But if you have the totality of culturally and linguistic appropriate services, they are much more inclined. These are all research-based discoveries. So, for every one of these outcomes, you can go back to a study from where they found these things. And then at the 9 o'clock on the clock, reduce liability and malpractice suits. And that's especially important in today's healthcare, because one of the reasons it's so expensive is because there are mistakes being made, and then doctors or hospitals or facilities try and cover it up, and they end up getting the lawyers involved. So, what does culturally and linguistically appropriate services actually mean? So we call it CLAS, C-L-A-S, because it's a cute little acronym. It was developed by the U.S. Department of Health and Human Services in 2000 in response to the need to ensure that the recipients of healthcare services are provided equitable and effective treatment. And that, of course, is what we're looking for. Equitable, meaning fair, meaning everybody gets a certain level of service, and effective, being, that it works. DHSS, or the Department of Health and Human Services, is the United States government's principal agency for protecting the health of all Americans and providing essential human services, especially for those who are least able to help themselves. The department includes more than 300 programs covering a wide spectrum of activities. Okay, so the next several slides will cover the class standards, and we are going to organize them by theme. So, first we have the professional relationship between the healthcare provider and the client. Number 1, healthcare organizations should ensure that patients receive effective, understandable, and respectful care in a manner compatible with their cultural health beliefs, practices, and preferred languages. So that's where that cultural competency that we talked about in the previous lecture comes into play. Understanding the major elements of a culture so that you can work more efficiently with your client because you understand where they're coming from a cultural perspective. Number 2, healthcare organizations should implement strategies to recruit, retain, and promote at all levels a diverse staff and leadership that is representative of the demographics of the service area. And again, if you are in the Philadelphia region, for example, there's a large number of African Americans. On the other hand, if you go out somewhere like Iowa, you're not going to have a lot of African Americans. You're probably going to have a lot more people who come from religious minorities like Mennonites. Then number 3, Healthcare organizations should ensure that staff at all levels receive ongoing education and training in culturally and linguistically appropriate service delivery. And again, what we're looking at here is the idea that when we engage professional development, we need to also be keeping in mind that in addition to the technical skills, we also need to become more culturally efficient in our jobs. Language access services. Number 4, healthcare organizations must offer and provide language assistant services at no cost to each patient with limited English at all points of contact during all hours of operation. While telephone interpreters are acceptable, face-to-face interpretation is preferred. Healthcare organizations must provide verbal and written notices informing them of their right to receive this language assistant services. So number 5 really does kind of mandate what number 4 is saying. So we have to make sure that the person we're interacting with is aware that they have these rights. Number 6, healthcare organizations must ensure the competence of language assistance provided to clients by interpreters and bilingual staff. Family and friends should not be used to provide interpretation services unless requested by the patient. And a lot of times you will have a patient who comes in with a sibling or one of their children or a parent who's going to translate for them. And of course, if they bring the person in, that means that they probably are okay with this. Number 7, healthcare organizations must make available, easily understood, patient-related materials and post signage in the language of the commonly encountered groups represented in the service area. So, for example, in California, because you do have a lot of different Asian cultures coming out and immigrating to the West Coast, you might see a lot of different Asian languages being represented, especially Filipino or Chinese. All recipients of federal funds, that's all the doctors' offices, hospitals that receive federal funds, are mandated to meet standards 4, 5, 6, and 7 without cost to the client. However, healthcare providers who only receive Medicare Part B payments are specifically excluded from these guidelines, and that's usually places that service the poor, and they are already working on a shoestring budget. All Department of Health and Human Services view the lack of an interpreter service for individuals with limited English proficiency as a form of discrimination, as outlined in the 1964 Civil Rights Act. Then we move on to organizational support in maintaining the standards. Number 8, healthcare organizations should develop and implement a written strategic plan that outlines clear goals, policies, and operational plans with accountability and oversight mechanisms to provide culturally and linguistically appropriate services. So having the plan in place allows you to assess whether or not the plan is successful. If you don't have a plan in place, you have nothing to test. So that plan gives you an opportunity to implement and then follow the feedback loop to see if it's productive. Healthcare organizations need to conduct ongoing self-assessment of class-related activities. And there we go back to number 8 with that feedback loop. And finally, number 10, healthcare organizations should ensure that data on the patient's race, ethnicity, and spoken written language are collected in health records and integrated into the organization's information system. So if you already know that patient who's coming in at 11 a.m. is going to need an interpreter, you can have that person standing by and it won't delay the day. Then we move on again, so some more of our organizational support in maintaining the standards. Number 11, healthcare organizations should maintain a current demographic, cultural, and epidemiological profile of the community, as well as a needs assessment to accurately plan for and implement services that respond to the characteristics of the area. So are there certain issues that seem to crop up a lot? For example, you're going to have significantly more HIV cases in a big city than you are in a small town. On the other hand, where there's a lot of immigrants from a certain country, you might see an outbreak of tuberculosis. So all of these issues that come into play are not meant to discriminate, they're really there to assist and help. Number 12, healthcare should develop partnerships with communities and utilize a variety of formal and informal mechanisms to facilitate community and patient involvement in designing and implementing class-related activities. So, connect with these different organizations. So, for example, there might be an African American fraternity or sorority that you could work with for educating people on healthcare in terms of their heart or diabetes. So there's always ways to connect with different groups that offer a culturally diverse environment. Number 13, healthcare organizations should ensure that conflict and grievance resolution processes are culturally and linguistically sensitive and capable of identifying and resolving cross-cultural conflicts or complaints by consumers. If you have someone who has come in from, for example, Saudi Arabia, a man, he does not want a female doctor. It's against his culture to be seen naked by anyone other than his wife. So at that point, you really need to kind of look at the situation and see if you can accommodate him. Number 14, healthcare organizations are encouraged to regularly make available to the public information about the progress and successful innovations in implementing the class standards and to provide notification to communities about the availability of this information. Having the standards is only part of the program. You also need to make sure that the community knows about it. And that's where it comes into play with the idea of connecting with these different culturally diverse groups. So, some of the concerns that have been raised include the complexity and measurability of the outcomes. How do you measure an outcome like this? You have to be able to quantify it in some way. Maybe you're using client satisfaction surveys. Maybe you are using how often somebody returns to that doctor or hospital. There's a variety of ways that certain institutions will measure the compatibility or the compliance with the class standards. The problem, however, is there's no designated measure that should be in place. And then the overall cost for interpreters and translators is also very expensive. And if you are a small practice or if you are a practice that's barely getting by, this is the kind of thing that could bankrupt you. So, that's it for today. If you have any questions, please text or email your instructor. If you are not a student at our college but still have a question, please leave a comment and we will get back to you as soon as we can. Have a fabulous day. Thank you.